If you're an active woman struggling with leakage, pelvic heaviness, prolapse, or pain with intimacy before pregnancy, during pregnancy, or postpartum, and it's keeping you from doing things like working out, playing with your kids, or being intimate with your partner, I created this video to show you that it is possible to resolve your symptoms and feel confident in your body again. Imagine being able to go to a workout class with your friends without peeing yourself, or being able to hold your kids for a long period of time without feeling constant heaviness or pressure down there. That's exactly what we're going to talk about today, because none of these symptoms should have to hold you back from living the life that you want to live. It doesn't just impact you physically, but it takes a toll on your mental and emotional health too. Things like leakage, heaviness, and pain don't have to be a part of your life forever. And with the right plan, you can see significant improvements with just a few weeks and achieve full symptom recovery after a few months. And that's exactly what I help women with. The problem is that so many women try to figure this out all on their own, or maybe you went to your local PT clinic and were given basic exercises like Kegels and breathing and never progressed past that and your symptoms never fully went away, or you've just waited years to address it because you're embarrassed. Instead, you need to have a safe space and be given a holistic, science-based, progressive rehab plan that's specific to your body and your goals and that gets truly down to the root cause. This needs to include reconnecting and recoordinating your core and your pelvic floor, rebuilding strength and mobility through full body exercise, and restoring lifestyle habits to resolve your symptoms long term. These are things that traditional PT often overlooks. So in this video, I'll show you the exact approach I've used with my active clients to finally help them resolve their leakage, their heaviness, and their pain, all without surgery, medications, and wasting time on rehab and exercises that don't work for them. That's how I'm able to get messages like this every single day from my clients. It's not your fault that you haven't seen progress or are using outdated methods to help resolve your symptoms. I'm sure you've probably tried Kegels, maybe some breathing exercises, or you're just pushing through it when you're on your runs or at the gym. But the reality is, the reason that's not working is because it's a lot more complex than this. With that being said, there aren't a lot of pelvic floor specialists out there, and it's so hard to get into the clinic to see a good one. And in the traditional physical therapy setting, PTs are seeing multiple patients at once, and they don't have enough time with their patients to truly get them better. That's why traditional physical therapy can fail to fix your leakage, heaviness, or pain. Unfortunately, a lot of women are also given low-level, easy exercises that are meant for sedentary women and don't progress past this, which doesn't help you recover to meet the demands of being a mom during pregnancy or being someone who's an active woman who runs or lifts at the gym. So let's dive into what the pelvic floor is and how you can resolve your symptoms. The pelvic floor is a group of muscles, nerves, and ligaments that sits at the bottom of your pelvis, and we actually have a bunch of different pelvic floor muscles, but they connect together and they form a bowl or a hammock at the bottom of your pelvis. They have a ton of different functions. They play a huge role in your bowel and bladder function. They provide blood and lymphatic flow. They keep your pelvic organs supported, and they play a role in your sexual function as well as stabilizing your spine and your hips and your pelvis. Things like leakage, heaviness, or pain can become an issue when there's increased tightness and or increased weakness in the pelvic floor. And this is where a lot of women are given Kegel exercises to activate and breathwork exercises to relax your pelvic floor in traditional physical therapy. And these are really good foundational things to be able to do. It's important. We don't want to skip that step, but you have to progress past that and figure out what the root cause of why your pelvic floor is weak or why your pelvic floor is tight to truly resolve your symptoms. So how do you fully resolve the symptoms and get to the root cause? Based on years of helping women overcome pelvic floor dysfunction and science-backed research, I've created my 3-phase pelvic wellness method to help active women resolve their leakage, heaviness, and pain. The first phase includes reconnecting with your deep core system because you have to have a strong foundation to build upon. The pelvic floor doesn't work by itself, and that's why Kegels alone don't work. It works with other deep core muscles to help you manage pressure and maintain good stability in your spine, hips, and pelvis. I love this visual here on the screen because it shows how the pelvic floor works with your diaphragm, which is your main breathing muscle, your deep abdominal muscles, and your spine. It's crucial that you learn to coordinate these muscles to work together so you aren't getting too much pressure on your spine and pelvic floor because that can lead to symptoms of leakage, heaviness, or pain. In this phase, we also do a root cause movement assessment where I use my background in movement and anatomy to identify what imbalances in your body are the root cause of your pelvic floor symptoms. And this also helps me create a custom exercise and lifestyle plan to set your body up for success. Next, we move into the second phase, rebuilding full body strength and mobility. The way your hips, your spine, and even your feet are moving and their overall strength directly impacts the way your pelvic floor functions. Take my client Kirsten, for example. She had tightness in her hips and weakness in her core, and these imbalances were causing pelvic floor tension, which led to symptoms of urgency and leakage. But by focusing on building full body strength and mobility, we were able to resolve her leakage while playing with her kids and when she was at work. Similarly, my client Grace had feelings of heaviness and pressure postpartum, but by working on her full body strength and mobility rather than just doing Kegels, she was able to return to walking and is getting back into trail running postpartum without having symptoms. We have to focus on building strength with intention in this phase by integrating pelvic floor and core coordination from the first phase into it. This will help reduce excessive demand and pressure on your pelvic floor. The third phase is focused on restoring your body. This means challenging your body through more difficult exercises physically, but also tapping into your lifestyle habits because things like your stress, your nutrition, your hydration, and your mindset all play a huge role in how your pelvic floor is functioning and how it's reacting. Making small changes throughout all the phases and educating you on how these influence your body is a huge component to maintaining symptom-free long-term. I want you to know that you don't have to live with these symptoms forever. Focusing on healing your body before, during, and especially after pregnancy can make a huge difference. I use my 3-phase pelvic wellness method to guide you through healing with my education and guidance and support so you can feel confident in yourself. I've helped hundreds of women overcome pelvic floor dysfunction, and my goal is to help as many women as I can. My approach is 100% online because I know life can be busy with work, with kids, and everything else. I want to make it easy for you to be successful and be able to stay consistent and feel supported every step of the way. And if you're worried about fitting it into your schedule, no worries. My method only takes about 20 to 25 minutes, 3 to 4 times a week, and you can do it from home or at the gym. If you're ready to resolve your leakage, heaviness, pain, or just want to heal your body postpartum so you can be active again and live with confidence, I'd love to connect with you on a free video call where we can discuss your goals and whether my approach is the best fit for you. Feel free to click the link below to schedule your free call. Remember, you deserve to feel confident, strong, and be able to live your life the way you want to without feeling limited. Don't wait. Every single day that you put this off, you're letting your symptoms control your life. The longer you wait, the harder it can become to fix. You got 2 choices: keep struggling or take action today.